My name and specialty is Marc Labbe, orthopedic surgery, sports medicine, and arthroscopic surgery. So the services I offer are focused on sports medicine and also trauma. On the sports medicine side, those surgeries revolve around the shoulder, knee, and elbow. With the shoulder specifically. On the trauma side, I'll basically treat anything other than spine surgery. Having done a lot of trauma in my training, that's something very familiar to me. So what led me to choose medicine is, to be quite honest with you, the only thing I've ever known to do since I was 8 years old. I clearly remember it. I was riding home with my dad. We were in the car, and I just thought to myself, I want to be a doctor one day. And that thought never left me ever. My philosophy is to have the patient achieve the goals that they want with their particular problem. For some patients, that may mean just getting their hand up to the top of their head so that they can fix their hair in the morning. For some patients, that means throwing a 90-mile-an-hour fastball. And so, we define success at the beginning when we identify what the problem is and understanding what the possible outcomes are. Because I want to, number one, give them a good diagnosis, figure out what's going on with them, and then lay out the treatment options, surgical, non-surgical as indicated, and really see what fits their lifestyle. For me, that's what we want to do, get the patient to the place that they want to be with what they've got going on. A patient should see someone like me either on referral from their primary care physician, or we like to consider ourselves really the primary care musculoskeletal doctors. So someone has a sore extremity, a shoulder, a knee, and elbow, something that's been bothering them for a few weeks, maybe a few months, or if they injure themselves, either the athlete on during the week or the weekend warrior, they sprain something or twist something. It can be often hard to know exactly what you've done until you've seen somebody. So if there's a concern about an extremity problem like that, then come and see us. To see my patients pain-free is extremely rewarding. I tend to follow my patients fairly closely after surgery or even non-surgical treatments. And the day I get to say, hey, you don't have to come back anymore, we jokingly in our office call that a graduation day. And so that's always great when someone gets to graduate. Houston Methodist, the Woodlands Hospital, provides the best of the best in the local area. And so patients can come from all over, not just the Woodlands, and have one place to treat any medical problem they may have.